diabetes, HIV, AIDS, and Parkinson's disease. Some medical treatments, particularly chemotherapy and radiation therapy, can also cause dry mouth. In addition, more than 1,000 medications and treatments list dry mouth as a possible side effect. Dry mouth is serious because, if it's untreated, it can lead to rampant tooth decay. Without saliva, plaque builds up on your teeth and produces acid. This acid dissolves the enamel of your teeth, causing cavities. To make matters worse, when dry mouth sufferers use sugar-sweetened gums, candies, or drinks to ease the dryness, the sugar provides fuel for the plaque and enables decay to develop even more extensively. To determine the best treatment for your dry mouth, we'll take a complete health history and perform a thorough examination. A professional cleaning will remove plaque and tartar and will restore any decayed teeth. We'll also talk with you about steps you can take at home, such as brushing and flossing after every meal, running a humidifier at night, avoiding caffeine, alcohol, and tobacco, which dry out the mouth, and using sugarless candies and chewing gum sweetened with xylitol, which inhibits decay-causing bacteria. Depending on the situation, we may also recommend artificial saliva, moisture replacement products, or a moisturizing toothpaste. And we may suggest a fluoride treatment to strengthen the enamel of your teeth. With proper treatment and care, we can ease your dry mouth and help you be healthier and more comfortable. One of the most common problems in dentistry is sensitive teeth. If you have sensitive teeth, you may feel discomfort when they're exposed to cold air, hot or cold food and beverages, or sweets. There are many possible causes for the problem, including improper stresses on teeth, loss of the tooth's protective enamel layer, and occasionally some dental procedures. One of the major sources of improper stresses is the unconscious habit of grinding and clenching the teeth. Another source of stress occurs when teeth don't come together properly. Some teeth always hit sooner than the rest, and they become sensitive. Teeth also become sensitive when they lose their protective outer layer, exposing the dentin. The dentin is the middle layer of the tooth, and it's normally protected by enamel above the gum line and cementum below it. Dentin contains millions of tiny tubes that extend from the nerves at the center of the tooth to the outer layer. When the dentin is exposed, these tubes are left open. Any stimulation at the surface of the dentin is transmitted through the tubes to the nerves, causing pain. The dentin can become exposed through various processes, such as abfraction, erosion, and abrasion. Abfraction occurs when one tooth hits sooner than the rest, causing the tooth to flex. Over time, continual flexing causes the enamel to separate from the dentin. Erosion occurs when acids dissolve the enamel. This is often caused by the frequent sipping of acidic soft and sports drinks, or exposing the teeth to stomach acids through acid reflux disease or bulimia. Abrasion takes place when the protective layer is worn away. This can happen when you brush too hard, use a medium or hard-bristled toothbrush, or use an abrasive tartar control or whitening toothpaste. Lastly, some dental procedures, such as bleaching and placing restorations, may sometimes lead to short-term sensitivity. Left untreated, tooth sensitivity can have far-reaching effects. Sometimes it stops people from brushing and flossing their teeth properly, which can lead to more sensitivity, decay, infection, and even tooth and bone loss. To determine the cause of your tooth pain, we'll perform a thorough examination. If the problem is improper stress on teeth, we may adjust your bite or recommend that you wear a mouthguard. If the problem is exposed dentin, we may present a plan for improved brushing techniques, counsel you about your diet, treat the area with fluoride, or apply a protective coating or bonding agent. Short-term sensitivity can often be handled by using a desensitizing toothpaste or mouthwash. With proper treatment and care, your sensitive teeth can once again be healthy and comfortable.
When heavy plaque and tartar deposits have built up on your teeth, we often recommend a procedure called full-mouth debridement to remove them. Plaque is the sticky, colorless film of food and bacteria that constantly forms on your teeth. If it's not removed every day, plaque hardens into tartar, and over time, plaque and tartar build up on the teeth. A heavy buildup blocks our ability to clearly see and examine your teeth and gums. It is also important to remove the accumulation of plaque and tartar because they are the main cause of tooth decay and gum disease. Many factors can contribute to a heavy buildup, including dry mouth, tobacco use, certain health conditions, wearing braces, poor home care, and not getting regular professional dental cleanings. Depending on the situation, we may begin the procedure by applying a numbing gel or offering nitrous oxide to make you more comfortable. Then we'll use a variety of instruments to carefully remove the plaque and tartar above and around the gum line. We may also apply an antimicrobial rinse. We'll finish the procedure by carefully reviewing your home care routine. A full mouth debridement is an important initial step in the ongoing evaluation and treatment of your oral health. We recommend that you get a routine dental cleaning to remove plaque and tartar. Plaque is the sticky, colorless film of food and bacteria that constantly forms on your teeth. Even when you brush and floss properly every day, some plaque remains and hardens to become tartar. Tartar can be removed effectively only with a professional cleaning. It's important to remove plaque and tartar because they are the main cause of tooth decay and gum disease. To clean your teeth, we'll use a variety of instruments to carefully remove all the plaque and tartar above the gum line. These instruments may include hand scalers, an ultrasonic scaler, and dental floss, superfloss, or other flossing aids. We'll also use polishing instruments to remove stains from your teeth. We'll carefully review your home care routine as well. With regular dental cleanings, we can help you maintain a healthy mouth and a beautiful smile. When gums recede and expose the roots of the teeth, a gingival graft can repair the damage. The loss of protective gum tissue can lead to significant decay in the roots and painful sensitivity. It can also age your smile. We'll begin the procedure once we're sure the area is completely numb. At the damaged area, we gently separate the gums from the tooth. We then carefully remove any plaque and tartar from the root surfaces. We take a small tissue graft from another area in your mouth. That site can heal on its own, or we may place a stitch or two. The graft is then seeded to fill in the missing gum and stitched into place. As the gum tissue heals, it tightens more closely around the tooth. After a few weeks, the gum tissues should blend in beautifully. Gingival grafting helps protect root surfaces from decay, can keep roots cleaner, may reduce tooth sensitivity, and can improve your periodontal health. It's a safe way to restore your gums and keep your smile beautiful. If you have lost a tooth due to periodontal disease, you probably have significant bone loss. That's because when you lose a tooth, the jaw becomes smaller where the tooth was. Lost bone doesn't grow back on its own, but we might be able to augment it in the upper jaw with a sinus lift. This may be a necessary surgery for you if you are preparing to get an implant and your periodontal disease significantly reduced the bone, or if your sinuses are very close to your upper jaw. You should let us know if you have seasonal allergies. We'll want to schedule your sinus lift when they are least active. We'll take X-rays or send you for a CT scan to accurately measure the width of your bone and position of your sinus. Prior to your surgery, we'll prepare the grafting material taken from your own tissue or from another source. On the day of your surgery, we'll make sure the area is completely numb before we begin. We'll make a small opening in your gums and open a space in the existing bone. We then gently push the sinus up and away from your upper jaw. We place the grafting material in the space where your sinus was and stitch the area closed. Depending on the material, It should take between 6 and 12 months for the graft to fuse with your bone. Once the bony material has fused with your upper jaw, you will have enough bone to hold an implant. Having a sinus lift helps increase the size and strength of your bone and gets you one step closer to a healthy, beautiful smile.
After your scaling and root planing procedure, we may administer Arrestin to control the infection and promote healing. Arrestin is an antibiotic that kills the bacteria that cause periodontal disease. It's in a granular form that we place in the periodontal pocket formed between your gum and your tooth. The moisture in your mouth makes it adhere to both the pocket and tooth surface. A steady flow of the antibiotic is released for up to 21 days to reduce pocket depth and the spread of the disease. Arrestin is not right for everyone and could interfere with any other prescribed or over-the-counter supplements you may be taking, including vitamins. So we will ask you about your medical history. Arrestin is in the tetracycline family of drugs and should not be used by people who are pregnant, allergic to tetracycline, or under 8 years old. Our goal is to help speed your healing. If Arrestin is right for you, we'll discuss it with you and talk to you about how we can get your periodontal disease under control.
An aesthetic crown lengthening, sometimes called a gum lift, is a safe and predictable procedure for reshaping bone and gum tissues when teeth appear too short or when the gum line is uneven. We'll begin the procedure when we're sure the area is completely numb. We then make small incisions in the gums and gently lift them away from the tooth. We reshape the bone and gum tissue to reveal more of the natural tooth and to maintain a healthy distance between the bone and gum line. Then, a couple of stitches are placed in the gums to speed healing. After a few weeks, the gums will heal completely. If necessary, we can then bond a crown, veneer, or composite resin restoration to improve the shape of the tooth. An aesthetic crown lengthening can make a dramatic improvement in the look of your teeth and help you get the smile of your dreams.
Minimally invasive dentistry is an emerging philosophy in oral health care. The goal is to assess your risk for diseases before they occur, which can help prevent damage to your teeth and gums. Minimally invasive dentistry is made possible because of advancements in science. We have a greater understanding of oral diseases on a bacterial and cellular level. We have advanced diagnostic instruments and advanced procedures and materials that save more of your natural tissue and can even encourage your body to reverse damage. The first step is the least invasive, a conversation. We'll discuss your goals, home care routine, your diet, and general health issues. Some problems can be addressed very conservatively. For example, if you take medications that dry out your mouth, making you more susceptible to dental diseases, we can recommend products to enhance your body's defense system. Here in the office, we can see more than ever before, from microscopes that give us a high-definition view to cone beam X-ray scans that produce a 3D view of your hard and soft tissues. Lasers may be used to clean out small areas of decay in teeth, often without anesthesia. For periodontal disease, we might use laser therapy to shrink, decontaminate, and initiate healing of the pockets around teeth where the bacteria live. These are just some of the aspects of minimally invasive dentistry. Our goal is to be your partner in achieving your best dental health. Of the 34,000 Americans diagnosed with oral cancer each year, only half will survive for more than 5 years. That's because oral cancer often starts on the basement level of your mouth. By the time you notice symptoms, or the lesion can be seen by the naked eye, the cancer has probably been growing for a significant length of time. Velscope is a sophisticated technology that helps us find diseased tissue deep below the surface, long before it's visible. And if we catch it early, there's an 80% chance of curing it. Valscope uses a harmless blue light that is absorbed by the molecules in the mouth. This exam is safe, painless, and only takes a few minutes. Normal, healthy tissue emits a pale apple-green glow. Diseased tissue will appear dark green or black. If we find a suspicious area, we'll talk to you about the next steps. Valscope does not diagnose cancer, but it alerts us to areas of concern earlier than ever before. And a Valscope exam showing normal, healthy tissue can give you instant peace of mind. Valscope is one more way we continue to give you the best care possible. Oral cancer is deadly. That's because it's hard to detect and usually isn't diagnosed until it's very far along. However, the sooner we find it, the better chance you have of surviving. That's why we use Identify. The Identify Oral Cancer Detection Wand uses 3 distinct light wavelengths to detect cancer in its earliest stages. First, we use an ultra-bright white light to view all surfaces of the oral cavity. The wand has a small mirror that allows us to inspect areas that are not easily visible to the naked eye. We then put on special glasses and activate the violet light in the wand. As we re-examine the mouth, we look for a contrast in color. Healthy tissue will emit a blue glow called fluorescence, but abnormal tissue will appear almost black. Finally, we'll use a third wavelength of light that allows us to see the health of the blood vessels. In healthy tissue, they are clearly defined. In unhealthy tissue, they grow randomly and appear dark, fuzzy, or cloudy. If we do find suspicious tissue, we'll discuss the next steps with you. Identify's tricolor light wavelength technology helps detect abnormal tissue with great accuracy deep under the surface. It helps to distinguish between benign and malignant tissue lesions, reducing the chance of a false positive diagnosis. Regular oral cancer screenings with Identify can save your life, and our goal is to keep you in the best health possible. If you put off needed dental treatment because you're afraid of the procedures, then IV sedation might be right for you. Intravenous sedation can help if you get extremely nervous at the dentist's office, want to have several procedures in a single visit, don't want to remember the dental procedures, or have a difficult time getting numb. Before we use IV sedation, we'll discuss all of your sedation options with you. We'll take a medical history and ask if you are allergic to any medications. On the day of your appointment, you must bring a responsible adult who will stay with you for the entire day. We'll take your blood pressure before we begin. Our staff is highly trained and will monitor you throughout the procedure. A simple device clipped onto your finger will give us a constant readout of your pulse and oxygen levels. If you're nervous about getting the intravenous sedative, we may offer you nitrous oxide first to help you relax. When the sedative begins, you will go into a deep state of relaxation almost immediately. You will be unaware of the procedure, but you will still be able to respond to conversation. We'll begin the procedure when we're sure the area is numb. During the procedure, time will pass very quickly for you, and you won't be distracted by the sights, sounds, or aromas of the dental office. When we're done and we remove the sedation, you'll awaken with no memory of the procedure. We'll take your blood pressure one more time. In about half an hour, you'll be alert enough to go home. However, a responsible adult must drive you and stay with you for the rest of the day. Once you leave our office, don't operate a motor vehicle, don't do any strenuous activity. Plan to relax for the rest of the day. When you're hungry, only eat a light meal. Don't drink alcohol, and only take medications as directed by your dentist. IV sedation is a safe procedure that can help you get the dental care you need and back on the road to good oral health. X-rays are an important diagnostic tool in dentistry, but X-rays can only give a two-dimensional side view. Now, cone beam X-ray technology produces a high-resolution, three-dimensional color image with unprecedented detail. We can zoom through the image to view bone and soft tissue with incredible accuracy. And we can see images from every angle, including the biting surfaces of teeth. This can be used to create a 3D model to be used for planning and eliminate the need to take a traditional impression. To get a cone beam CT scan, simply ease into the chin rest. The procedure usually takes only a few seconds and can be done right here in our office. As the camera moves around your head, a cone-shaped beam gets a complete X-ray. The precision of the 3D image is extremely useful in placing implants, planning orthodontic treatment, locating root canals, evaluating problems with the jaw joints, and diagnosing possible cysts, tumors, or infections at earlier stages. Cone beam X-rays help us plan your treatment with increased accuracy and a more detailed diagnosis. It's a technological advancement that helps us improve your oral health. Full mouth reconstruction is the rebuilding of most or all of your teeth. This may be necessary to help your teeth function properly and alleviate your pain. You may be a candidate for full mouth reconstruction if you have continuous pain in your jaw, face, neck, or shoulders, have constant headaches, have lost teeth through decay or trauma, or have several teeth that are cracked, worn, or broken. The first thing you must know is that for full mouth reconstruction to be successful, you must make a commitment to the entire process. Reconstruction involves extensive planning and multiple procedures that could take anywhere from a couple of months to a couple of years. We begin with a comprehensive exam. We'll first diagnose the health of your teeth, looking for breaks, decay, and root canal issues. Next, we'll check the health of your gums and measure your pockets. If you have periodontal disease, we'll have to get that under control. We'll create a plan for you and discuss each procedure. We'll explain why the procedure is necessary and how all of the procedures will work together to achieve your goals. All of this is done to get you healthy and relieve your pain. But the added bonus of a full mouth reconstruction is beautiful teeth. You'll get to choose color and shape and get the smile you've always wanted. Full mouth reconstruction is a commitment to your overall health. Our goal is to help you live your life free of pain. Serious athletes know they need the protection of a mouthguard. But even recreational sports enthusiasts can benefit from them because there's a new style of mouth protection that can improve any athlete's stamina and performance. Under Armour mouthwear has been proven to increase an athlete's strength and endurance, decrease athletic stress, and improve reaction time. The mouthguard will also help reduce the possibility of a concussion and help protect your teeth and jaws during impact. There are two types of performance-enhancing mouthwear. The mouthpiece that fits over the lower jaw is used for non-contact sports. If you play full contact sports, you would wear the lower jaw mouthpiece during training. The mouthguard that fits over the upper teeth is used while playing contact sports. It improves performance and helps protect your teeth and jaws from impact. How can a mouthguard make you stronger? Whether you're training or playing, you're putting your body under stress, causing your jaws to clench. The clenching puts pressure on your TM joints, signaling the brain to release a stress hormone called cortisol. Excess levels of cortisol increase fatigue, decrease metabolism, and reduce muscle building. Under Armour Performance Enhancing Mouthwear relieves clenching and helps your jaw stay in a relaxed position. The device draws the jaw down and forward, relieving the pressure on the jaw joint and short-circuiting the excessive release of cortisol. The jaw position also helps increase airflow. More oxygen helps inhibit the buildup of lactic acid in muscles. If you think this mouthwear would be beneficial to you, we'll take impressions of your teeth. These will be sent to the lab to be fabricated to your specific dimensions. In about 2 weeks, you'll come back and we'll check the fit. Performance-enhancing mouthwear such as Under Armour can help give you the competitive edge and protect your healthy smile.
Chapter 3: The Kirby Technique for Cool Brushing. As Kirby's dreams continued, he remembered all the mistakes he made when he first started to learn to brush his teeth. His dental hygienist had said, "Move your toothbrush back and forth, not your head, and don't worry if your ears flop a little. Vibrate the brush and move it in short back and forth strokes, and in small circular motions, not those giant back and forth strokes. Try a lot of different angles of brushing. But this is the one that works the best. Don't use the biggest toothbrush you can find. Use the right size brush with soft bristles. Use a toothpaste with fluoride and carefully place it on your brush. Brush in the bathroom in front of a mirror, not upside down. Move an electric toothbrush gently around your mouth. Don't bite on it, and never take it apart." Kirby learned his lessons well. In fact, his techniques became legendary. The Kirby technique of cool brushing was an international success. As Kirby talked to people, he would explain, you start with the insides of the upper teeth, then go to the insides of the lower teeth, then the outsides of the upper teeth, and the lower teeth. Don't forget the chewing surfaces of the upper teeth and the lower teeth, and tilt the brush to brush the backs of your upper and lower front teeth. End by brushing the roof of your mouth and gently brush your tongue. Kirby traveled far and wide, teaching children the amazing Kirby technique of cool brushing. Chapter 4: Flossing is a big deal. Kirby had heard flossing was important. He'd heard it was a big deal. He started flossing every day with very big floss. He soon learned that really big floss was a lot like brushing. It just couldn't get the plaque out from between his teeth. Kirby got very excited when he found smaller floss that worked better. Kirby really liked dental floss. It tasted good and was only a little tricky to handle. As he continued to practice, his flossing kept getting better and better. He soon perfected his flossing technique by using about 18 inches, winding it around the middle fingers of his hands, and then carefully pinching the floss between his thumb and first finger, leaving about an inch to work with. He learned to carefully pull the floss in a C shape around each tooth, and then clean the sides of the tooth using an up and down motion. He found it best to occasionally wind the floss to a fresh section, and then he would work his way around his mouth, cleaning both sides of every tooth. Kirby liked to floss. It wasn't hard to learn, and it removed the rest of the plaque between his teeth where the toothbrush bristles just couldn't reach.